Hello, everyone, and welcome to today's discussion on dementia-friendly libraries. I'm Katrina Harkness, the Adult Learning Consultant here at the Florida Division of Library and Information Services, and I am very excited about the project that the FSU College of Medicine's REACH program has been working on in coordination with Florida libraries to develop a statewide resource guide and training for dementia-friendly libraries. Today's session will update you on the work so far and let you know how you can be involved. And if your library is already involved with the initiative, if you'd like to drop something into the chat, we'd love to hear from you. And now I'd like to introduce Nicolette Castagna, our guest speaker, who is the Community Engagement and Health Systems Manager in the Department of Geriatrics at the FSU College of Medicine. Nicolette?
Thank you, Katrina. Thanks everyone for being here today. And if any of you have worked with us thus far, we just appreciate your continued efforts. There's around approximately 7 million people living with dementia in the United States. And most of those are cared for by a family member or friend. They're cared for in the community. And many folks that are caring for individuals living with dementia indicate inadequate community support in a lot of different sectors that we rely on for support and care. So it's one of our privileges with our grant to be able to work with different sectors to try to boost people's confidence and competence and understanding of how to best care for older adults and specifically persons living with dementia for the project that we've got going with the library systems. I am going to share a document that'll help guide the discussion and help give you all a visual for what we've been up to. Hopefully people can see my screen. I'm gonna zoom in a little. How's that look for people to be able to see? Does that look good, Katrina? Is that clear?
Yes, looks good.
All right, great. So what I'm hoping to cover with you all today is really give you an overview, just share what we've been up to since last spring of 2025, and then get you excited about what's coming and hopefully encourage participation and involvement in some capacity. So I'm with the College of Medicine, Department of Geriatrics. We have a federal grant from the Health Resources and Services Administration, which is geriatric workforce training. We have a 5-year grant. We're currently in year 2. And we also work with the Florida Department of Elder Affairs. They're our state unit on aging, and they have got a lot of really great initiatives to support our older adults in our state, and specifically their Dementia Care and Cure initiative, which focuses on helping communities to be more inclusive for those living with dementia, share resources, enhance community programming that's offered. So this really falls under that umbrella of the partnership with them. So what our grant has done, which we go by FSU REACH, if you see that, that's this geriatric workforce enhancement program, is last year under the leadership of one of our second year medical students, Mallory Eisel. She helped us complete a survey-based research project that explored the prevalence of dementia-friendly library domains. So in just a moment, I'm going to share the results of that survey with you all. So you can begin to see how you and your peers might have answered the questions on the survey, and it also shows an overview of those library domains. Based off of our findings from last year, we realized it would be really helpful to put together a guide that really encompasses all of this information, all the great work that you all are doing, plus additional information that you might not be aware of. So many of us, even healthcare sector, they don't receive a lot of training in how to care for older adults and some of the nuances that come up, especially when we're talking about working with someone living with dementia. So we can all use a little more education and I think access to information about this topic. So we got a dementia-friendly library guide and online staff and volunteer training module that we are working on as a direct response to your feedback, to libraries in Florida's feedback about what the need is. The last thing I want to share is we're going to be offering some resources to you all. We, yeah, long story, but we ended up getting a little bit extra money from the federal government, which I know that's not happening for a lot of people right now. But we're excited to like use it to just expand this activity and actually help provide you all with resources that your patrons can access. For family caregivers, for persons living with dementia. So we're going to be sharing an online application for that process very soon. But these are the three main things I'm hoping to cover today. And I do want to hear from you all. Um, I have a tool that I'll be sharing that's going to allow people to give some feedback. Please feel free to utilize the chat. I want to hear directly from you all because you guys are the ones doing this work in the field, and you can really help inspire some of the other libraries to learn from you. So we did our survey last year and went out to all the library directors back in April. The survey questions and structure was taken from the Dementia-Friendly America Library Sector Guide. That's a really great resource if people aren't familiar with that. And it helped us break down the dementia-friendly libraries into four specific and unique domains. So here's our survey results. We got 18 responses. Thank you for those. From pretty good geographical distribution from over in Shipley, Florida and Washington County down to Miami. We got some really nice feedback from different types of settings. I'm going to zoom in a little so you all can see this a little bit better. And I know it's a lot of text and a lot of information numbers here, but this just shows you the response for each question and the types of questions that we asked. As far as the training goes, it was probably our area with the lowest amount of prevalence that sites are offering dementia-friendly training to their staff and volunteers. But you can see some of the areas that training ideally would cover if it's talking about being more inclusive and just knowing how to communicate and interact with persons living with dementia. The basic kind of understanding the signs and symptoms. What am I seeing with this individual? How can I engage with them? What are some key best practice communication strategies? It's definitely different than other types of persons that you're interacting with. So, well, for example, one of the main things is we encourage people to just enter someone's reality. If they're a little bit disoriented about the time, or they might think they're a younger version of themselves, we really encourage people to just go along with it instead of arguing or correcting. And that is really unique for people living with dementia. So that's the type of stuff that a training would cover. And for the sites that are doing it, that's what their training is covering. Basic signs and symptoms, basic communication skills. Also, I know that many of you all are a social resources, social services hub and connector for so many issues for your patrons. So making sure y'all are plugged in and understand the network of care and how you can make those referrals and have, handouts and brochures on hand, flyers posted that are going to help people living with this situation and those that are caring for them. Also safety concerns. That's another area of, having a specific policies in place and kind of knowing how to de-escalate a situation, knowing what to look for and what to do. So those are some of the areas in the training section and how libraries in Florida answered. Another piece that I think people underestimate is how big of an impact the environment has on people's function, on people's ability to get around, to understand where they are on their own, even with some cognitive decline. People that are living with dementia are losing their ability to process context clues. Their perception and wayfinding abilities are often diminished. So having an environment that really helps alleviate some of those shortcomings that people have is going to be really helpful. Environment can be, a treatment in and of itself, a treatment for challenging behaviors or confusion if it's set up correctly. So how can that look? Signage that's at an appropriate eye level, easy to access buildings and aisles, places for people to stop and rest. When we talk about persons living with dementia, it also goes with just general older adult challenges such as mobility limitations, high contrast lighting and surfaces, trying to avoid flooring that's too busy. Some people have their depth perception is off, so it can kind of appear like an object is coming towards them, trying to reduce those types of things from happening and making just something harder on an individual who's already facing a lot of obstacles in navigating the world. Designated quiet spaces are helpful. Easy ways to get help from staff. Like, is it obvious who staff is? Is it obvious what staff's names are? So we encourage things like really large print name badges that help people like build rapport quickly with someone. Um, Also, family restrooms. I think that you all are very conscious about accessibility, and this was an area that a lot of folks, as you can see, responded pretty high. But just some unique things to consider with this population as well. As far as resources go, again, really great ideas, really great, good status of resources that you all are providing. There's a lot in this section. It's, books for how to care for somebody living with dementia, more of those caregiving skills, understanding the disease, understanding, navigating the legalities of it, healthcare system type things, healthcare decision making, all of the aspects of caring for somebody living with dementia. There's great print materials and books on that. But also we know that family caregivers can be very susceptible to caregiver burnout, to mental health challenges themselves due to self-neglect in an effort to care for the person that has dementia. So caregiver self-care is a really important subject as well. So having books and materials to encourage that. Um, Also, books that are appropriate for persons living with dementia. There's some really great resources out there, and many of which we learned about for the first time from you all. Specific books that are written that are adapted for persons living with dementia. There's some that are classic literature that are shortened and condensed and modified a little bit to make them a little easier to follow. Books that are highly illustrated but are still age appropriate. So there's really excellent resources out there for actually, the person living with dementia, their engagement. How do we help them stay social, help them read and explore things that bring out their interests and their strengths and their background and their history. It's all about positive engagement can really help someone, help prevent their decline, help prevent uh, challenging behaviors, and just keep people connected to their communities. This is what any of us would want if this was going on with us. So some of those other kits and other materials that you'll see that some of the libraries are offering in the resources section. There's also the display is another way to highlight these populations, family caregivers and persons living with dementia. And these are three ideas and examples that we shared for Brain Health Month, National Alzheimer's Awareness Month, and Family Caregiver Month. That is one thing I wanted to ask today is if any of you all did do displays for these months and you have a photo of that, we would love to have it. In this guide, we want it to be our dementia-friendly library guide we're working on. We want it to be very user-friendly. We want to show real-life examples from the field. So please send us the things that you have. We can't guarantee it'll be included in the final version, but we would love to see examples. See one, do one always makes things so much easier. So thanks in advance for that if anybody has it. And the last section of our dementia-friendly domains and the last area of our survey would be community programs. Does your library work with local organizations or just your own staff? implement activities for family care partners and or persons living with dementia. So this is another one that has a lot of opportunities and multiple options. Is it educational events, like just public education about dementia and Alzheimer's or brain health, more around the kind of preventative strategies for maintaining a healthy brain. Um, the Alzheimer's Association has a great, 10 warning signs of dementia. And they have a presentation that's engaging and ready to go. Several libraries are running that program, and it's something that's could be pretty easy to find the Alzheimer's Association contact in your area and deliver that educational activity. There's also educational events really focused a little more nuanced, focused on family caregivers that are actively caring for someone living with dementia. There's a lot to this disease or to the types of diseases rather that cause dementia, Alzheimer's being one of those types of diseases. How does someone navigate the holidays? How does someone care for themselves? Some of the elder law and legal aspects of it. So there's a lot of different topics that could be covered on educational events specifically for family caregivers. Support groups, another really nice way to engage with this population, whether it's like groups for people living with memory loss or groups for care partners. Sometimes people hold one meeting at the same time and they kind of splits off. So the family caregivers get their time in a room and persons with memory challenges get their time in a room. There's a lot of different ways of doing it, which we're gonna include in the guide and give you guys some, in-depth information about how you might be able to begin to offer this type of stuff and partner with folks that can help. Also, not related to anything educational or clinical, a social event. This would be a memory cafe. There's a lot of movement around the state with libraries offering memory cafes. This is a chance for people to socialize, have fun. It is not about education and knowledge. It's about socialization, just feeling like a human, making new friends, laughing, connecting with people that are living with similar challenges as you. So that would be the Memory Cafe activities. Um, so those are our survey responses. Are there any comments or questions so far about what you saw there?
And if you'd like to comment, feel free to put something in chat or just unmute yourself.
Okay. Um, Library display photos. I'm gonna I'll take them so you can email them to me. I'm typing my email in the chat right now. Send them my way if you have those library display photos or examples of any of the stuff that we're talking about today that you'd like to share. Um, can I share another person just ask about what libraries responded to these surveys? Um, hmm. I probably should have gotten permission for that. I don't feel comfortable sharing because well, we don't have any specific sites listed right now, and we want to get approval for the sites that did participate before we include them. It's probably not a problem, but I'm sorry, I don't feel comfortable sharing the specifics right now without getting those permissions. Um, a question from some of these ideas applicable to other mental issues. Someone's asking around other mental issues like Asperger's syndrome, for instance. I think potentially, a lot of times when we're focused on caring for and communicating with and providing services for people with like the highest level of need and deficits, it ends up helping other populations too with different conditions and different abilities, but we're still really focused on how to best work with that individual. So while we won't have direct, we're working on it. So if that's something that, like, including neurodivergence and including, autism spectrum, which Asperger's would fall under that right now, it might be something that we can add or at least link to really well done sources that would help provide that information. But there is a lot of overlap, especially with de-escalation skills and some of the environmental aspects to help people navigate and practice their own autonomy in an environment, even if they have some challenges. A lot of those things, there's a good amount of overlap there. Thank you for your questions. Um, Another one about will books and other resources shared in the survey be provided? Yes. So our library guide is going to have a lot of specific titles, brands on these activity kits, memory kits, recommended books. So yeah, we're going to share a lot of specific examples in the Dementia-Friendly Library Guide. Yes. Question, public or academic? Can you explain your question a little bit? Can you say it in a different way, please, Haley? This will be a publicly accessible guide. We want it to be very user-friendly for staff to be able to drop in and find the section on communicating with persons with dementia, or find the section on community programs and use it and take it and run with it. So we want this to be really user friendly for all levels of staff and volunteers. And this will be open access. We have a federally funded grant. Things that we work on are accessible to anyone that is requesting it. Um,
She
Oh,
may,
public libraries. I see. Okay, yes, public libraries completed the survey. That's the question that Haley. Yes, thanks, Haley, for your question. Time frame for the guide. The Everything has to be done, the guide and the training has to be done by this June. So we are in the thick of it. We've made some pretty good headway with our dementia-friendly guide and training, but we're, yeah, actively completing everything now. We're hoping the guide is going to be approved by DLIS and posted to the website by June of this year. Training module around the same time frame. So that's our time frame for that. Splendid. I'm glad that you think that's splendid. That's nice. Okay, thanks for your questions, everybody. Moving on, here's some comments that we got. We did open-ended questions for qualitative comments in our survey as well. These are some examples of what your peers shared in the survey, what dementia resources are provided. Books, memory kits, different kind of adaptive exercises for balance. There's also specific books for persons living with dementia that are really aimed at family caregivers to be able to check out so they can bring them home and help offer their loved ones some engagement and some reading opportunities. Emma Rose Sparrow here is one of the selections that we're going to be offering for you all we'll help purchase those for you. And we learned about that from this survey response. We also ask about challenges. So really trying to explore the need for training and for information sharing. And here's some comments that people shared around challenges. Many caregivers are not aware of the resources available to them. We hear this all the time. People have no idea that, like, right down the street, there's a respite site, there's a caregiver support group, and they qualify for state-funded in-home care. And so this is the type of thing we really hope to make an impact on, is just increasing awareness and like help-seeking behaviors for this population. People who wander out of the library. So we're hoping the guide and the training will cover a little bit about some of the challenges that can come up, some of the more difficult situations that come up, and how to prevent that. And then, quality resources and programming. couple more items here from the survey, and then I want to get into more feedback from you all on the guide and the training module. Um, like I said at the top of our conversation, there's not a lot of sites that are, at least from our, N of 18 survey respondents, that are doing training specifically on this topic. So we thought it would help make it easier to develop something that you all can utilize for that purpose. It seems like there's a need and an interest, and that's really what our grant does is build training resources around these topics. So we're excited to help meet that need. Um, we also were able to select a few locations that uh, responded with great ideas and great examples of what they are already doing to be inclusive for persons living with dementia. And it allowed us to get more in-depth information, learn about logistics, learn about the brands for these activity kits, and ways that they're partnering to offer community programming. So those deep dive interviews were extremely helpful. Here's some takeaways from this survey work that we completed in 2025. Um, there's a great already existing infrastructure and programming that libraries are offering. A really wide range of examples across these different domains: training, environment, resources, and community programming. But what people said was there's low awareness and low utilization rates of these resources. So, a lot of opportunity for public education about dementia-friendly support and about the things that are available in the libraries. Um, and there's really good ideas and models for that could be replicated. Other how ways that other libraries can learn from their peers to strengthen the services that they're offering and their dementia-friendly care that they're providing in their system. So those are some findings. Any other comments about the survey or any questions that you have about what we found before I move us along?
And again, feel free to throw something in chat or just unmute yourselves and ask a question or share a comment.
Okay. So our next steps is development of the dementia-friendly library guide. The guide is going to include, I'm trying to move my little Zoom window away from this. Okay, never mind. All right. The guide's going to include patron stories. So we want to have a narrative approach to really paint a picture of what it's like for an individual, and how to best respond to that individual. So we're going to have a lot of stories, a lot of case-based stories throughout the guide. We will be spotlighting specific libraries that are doing some really good work and examples from those sites. Like I said before, we'd love to receive pictures on displays or of ways that you all share about social services and you have resources that you connect to patrons to, like how is that actually get out? We want example pictures of that to be included in the guide. The guide's going to include dementia sensitivity training, communication skills, how to engage with persons with dementia, and safety tips. We'll have pieces about how to make the environment dementia friendly, resources, example resources for people living with dementia and their care partners, for care, knowledge, engagement, mental health, all the different areas that are important to address. Community programming, types of community programming, and types of partnerships that can make that community programming happen. And also, we'll include the survey summary and some of the background information on the research project that we completed last year. All right. So that's what the guide is going to look like. I'm going to move over to a Mentimeter, which is a way for y'all to share some specific feedback about what content you would like to see on the guide. Um, so are there particular situations that you encounter? Is there specific content that you want to make sure you address or you think is missing from the list that you just saw? This is a really neat tool. You can, um, let me put the link in the chat for us. And then you can also access it like from your cell phones if you want, or just go into your web browser, menti.com, and you type in the code 25658296, and your responses should start to appear on the screen. I thought this would be a little bit more enjoyable for us to see the feedback than just using the Zoom feature, Zoom chat. So we'll just give a few minutes to share feedback on what you think the dementia-friendly guide should include. And this is anonymous if that makes it you feel more comfortable about sharing ideas or questions or concerns that the guide can address. It's just going to pop up on the screen like you're seeing here. Thank you for your comments so far. Great stuff coming up. Okay, cultural nuances, really great point. All right, I'll give us another minute and see if anyone else has any thoughts. Comments about younger people with that might be experiencing early onset. It's yeah, and it's really it's not always obvious that this is that people are experiencing cognitive impairment. So definitely like helping folks know what to look for is part of what we'll be including. But these are really great suggestions. I really appreciate y'all's comments on that. Thank you. Okay. So to head back to our guide document, I want to also open it up if any of you are interested in reviewing the guide and reviewing a draft version of it and weighing in on sections that are missing, ways to enhance readability, usability. We're looking for people that work within the libraries to help us build this. We want it to be useful for you all, and you all know best because you're who we're creating it for. So let me know. I shared my email in the chat. You can email me. Katrina can probably help get feedback from attendees that might be interested. It wouldn't be a super time-consuming thing. It's just spending some time reviewing, perhaps being on one meeting or so, or just responding to an email with some feedback. We just want to make sure this is taking into, as much as it can is included in the guide. I will put my email back it's at the top of the chat. I will copy it and include it here again. Okay. Um, so the next thing, before I move on to the training module, are there any other comments about the guide? Anything that before we keep going on creating it, we need to make sure to consider? Okay. I'm going to read some of what people said here, not all of them for sake of time. But how to help people at certain times of the day, morning, afternoon, and evening. Does this even matter? Great question. Um, Helping to assist a lost or disoriented patron without a caregiver. Really important and can arise with this population. Absolutely. Um, Specific questions to ask someone to identify those who are looking for this type of information who may not identify themselves as such. If someone is maybe not even aware of their cognitive challenges, or they're not being really open or vocal about their spouse or their family member that's struggling. Um, how to respectfully and passively get the information out there while protecting someone's privacy. I think that's what this question's kind of referring to. Tips for creating dementia-friendly spaces and outreach, how to educate community members about local resources and events. Great, great comments, everybody. Thank you for contributing to that Mentimeter tool.
Nicolette, I see a question in the chat. Will we be able to edit and adapt the guide for our specific needs?
Anna, do you mind sharing more what you mean about that?
No, I was wondering, I imagine that guide is going to be a PDF, I'm assuming, or something like that.
Mhm.
Will we be allowed to take part, and maybe if we need to create flyers to give to some of our patrons? I mean, will we have that permission from you? I mean, to use that material, maybe, as I said, editing or chopping or taking just few parts or things like that.
This is a really great question. I'll have to take it back to my team, but I initially would say yes. We want you to maybe use the information to help create a flyer, to help create social media posts,
Correct.
to modify example flyers that are in there for your own purpose. Yes, we definitely want you to take the information and apply it to your setting. So I'm fairly certain that's going to be encouraged, in fact. Thank you for your questions.
Okay, thank you.
Yeah, absolutely. Um, all right. Moving into our online training, we have someone with us on the call today he's helping us as our consultant to instructional design PhD. So he's here to hear your feedback about the training. Um, but this is going to be a brief. Katrina did tell us that you all would want brief, 10-minute, like short little micro learning opportunities. So it's going to have a couple different sections, but staff volunteers will be able to drop in and complete it in a short amount of time, each of the sections. So the topics are going to be on understanding dementia, the dementia sensitivity training, which is the, communication skills and how to engage with the person, um, dementia-friendly environments, and community programs and partnerships. So the guide and the training module are really going to go together. The guide is going to help inform the training module. They're going to link to one another, and we're looking forward to that. So we did want to hear one more. I got one more of these little Mentimeter engagement or feedback opportunities for you all around what challenges do you encounter with staff training and volunteer training. We want to try to overcome any of those as we're building this. So I'm going to share one More meant to slide for you guys to participate in, please. So it is the same link, it's the same code. Just tell us what you encounter or what challenges you might face or what works well when it comes to staff and volunteer training so we can try to capitalize on that. Hearing or seeing a comment, we're overworked. It's really hard to devote time to training. I heard that. Okay. We're very short-staffed, find it hard to dedicate long stretches to training, so smaller bites at a time would be easiest. Thank you for the feedback. We do understand some of those barriers. Um, Lack of interest in the topic could be an obstacle. Great points. Very small staff at your site. There's two of you. You're doing good work there. Keep it up. So need very small bites of information. Um, Part of what we're hoping to also include in the training and the guide is to create a community so you all can learn and dialogue with each other, exchange ideas, best practices, questions that you have, some like really specific nuanced things that only you all would be encountering that you can help learn from each other. So that's another piece to the training that we're going to be implementing. Okay, so don't do what I did today and I just have a sheet of paper with a bunch of text on it. Make it visually appealing, don't squeeze too much text on a slide, and use good graphics. Thank you. Absolutely. We're definitely working on graphics and pictures and potentially some multimedia like with videos or at least audio that is demonstrating how to do some of these communication strategies. So that great feedback, great suggestions. Thank you. Any other thoughts on challenges or preferences, your wish list, if you will, for library and for staff and volunteer training? You can include it here. Role playing might be useful. We can definitely provide some ideas or scripts for role playing. We're not exactly sure how this is going to go yet, but we did have some sites share that they do more in-person training. So probably some facilitator guide type content, some role-playing content that can be useful. Might be something that we can put together. Any other comments here on our Mentimeter? Thank you all so far for what you included. Okay. I will stop sharing that. I thank you again. We also are interested for the training module, any sites that would want to be testers for the online module, or even sites that we could pilot this with once it is final. So please stay in touch, reach out to me, reach out to Katrina so she can help. We can be connected and work together along the way. Okay. The last section that I'm hoping to cover today with you all is announcing that we do have funding available to help purchase dementia-friendly resources for Florida public libraries. This includes print and books and print materials and activity kits for persons living with dementia. We are going to be sending out an online survey application very soon, like probably in the next couple days, excuse me, and those will be due by the end of February. Um, we will be making the purchases for and mailing out all the materials to the sites that were selected. So that's kind of how this will go. But that was the last thing I wanted to say. I'm hoping that y'all would be interested in that and that we get a good number of people to apply. It'll be approximately $1,000 per site, so you'll really be able to purchase some good stuff for multiple branches or just for one location. We would like to, we're going to try to, when we're selecting, at least have one recipient like per geographical region, but we're open to any and all sites applying to that. Okay. So that is what I had for you today. We've had some good comments so far in the chat and in the Mentimeter discussion, but I did get a question at the top of the meeting from the registration link. Somebody asked about graphic novels for persons with dementia, and I am not familiar with that. So I didn't know if anyone else on the call is. And you could help share that with the person that asked the question, put it in the chat or comment verbally right now about graphic novels for persons with dementia. We're going to look into it though, and might even include it in the guide. So I really appreciate the question, but I'm sorry I don't have an answer for that today. Who will be receiving the library resource applications? I believe it's going to go out to the DLIS team is going to help us send it out, send the opportunity out. I believe it'll probably go to the library director's email initially. Any comments on that? Maybe Katrina, you could chime in there about how we're going to get the resource application out or who it would go to.
Yes, we can get you an updated list, and we'll want to get you the latest list, just like we did for the survey.
Okay, so that's most likely going to get to the directors. So just ask your director to pass that on to you if you're the person that would really know, or help them know that it's coming. I know we get so many emails, so it could get buried. We'll send yes, we'll definitely send the link to the application to the people that participated today as a follow-up materials from our meeting. So that'll be could be a way to directly get it to you all instead of just relying on it going to the directors. But that's a great strategy. So thank you for that idea.